Let me show you how to save thousands of dollars moving from medical advertising to content marketing, which is an amazing shift that will make a massive difference. As soon as you make that shift, you're actually building a long-term set of digital assets that work for you. So what do we mean by digital assets? Let's take a closer look at what that means in action. Looking at one of the live strategies we have, you want your patients to be hooked by the content as soon as they land on your website, whether they come in through the homepage or a specific content page, giving a response to something that they were Googling for. If they were looking for a tummy tuck, you want them to land on that page. So content marketing is about using what patients Google for, and we've got the data, to build the content that actually hooks the patient and gets their attention, and then conveys a message of trust and rapport. It's about information, but it's also about adding that personal touch. You want the patient to get to know you and get a feeling for what the next step could feel like. And the next step is obviously the consultation that you want to book. You want the patient to ask a referral to your practice, or maybe change the referral, or just use that referral. So this experience is all about offering a glimpse of what you have to offer in that first impression on your website. So the information's there, and the way it's organized also conveys an emotive component. So patients really know what to expect because of the whole experience of the pages on your website and the way the information is presented. They start developing a feel for what the next step could feel like. So how do you get there? To make content marketing work for you so you can gradually reduce your spending on Google Ads or other types of advertising. How do you go from where you are now to this amazing situation? It takes 4 components. One is being strategic. We want to really know what you want to be visible for. The second one is content. As you've seen, we build the content pages so they are an answer to what the patient Googles for. Number 3 is amazing design, amazing web development that is responsive. So when we take a look at it on a mobile phone, we still, as a patient, we get that amazing experience of getting to know you. There's no hiccups, there's no information that's too small or too big. There is a really high quality experience when we visit your website on a mobile phone. Sometimes doctors think that having a responsive website just means that it works on a mobile. That's great. But what I've just shown you is more than just working. It's about really offering that premium experience to your patients so they can go through the information, get to know you, and make a booking. And the 4th component is measuring. You can put in place a great website and then forget about it. That's not a great strategy. So leading doctors, they just keep checking the pulse of their marketing strategy by checking in with us and discussing the analytics. What are patients doing on your website? Where do they click? Where do they stay? What type of information needs more improvement, needs to be presented in a more attractive way? So measuring and optimizing creates that culture of ongoing growth so you can build exactly the practice that you have in mind. If that resonates with you, book a free consult. We will discuss how this methodology, how content marketing could be applied to your niche, to your specialty, and how we can help you from where you are now to where you want to be. I look forward to speaking to you in your obligation-free Zoom consultation.